Dehydration. Hmm? You have to tell me the answers, no?
Professor, should I log out since I'm not taking this class?
No, this is nutrition class. Actually. You have to.
Just review?
Yeah.
Okay.
Log out at 11, so you know you're.
Hydration is when you lost too much water and
So what do you expect in the skin?
dryness.
Okay, to study, guys. What is dehydration? What causes dehydration?
Miss Joyce, this thing is blurry. I can't see it.
Blurry. Okay, hold on.
Very, very. I can't see it.
Wait.
It's not.
If I make it larger, is that okay?
It's all right.
How about now? Right?
It's too much.
Large. Oh, how about now?
I can't see it. I can make out just a bit what it is, but it's still blurry, you know.
How about the others?
It's fine.
Miss Joyce, can you just post it on the chat so that people can download it and they can
Didn't I post this in the chat?
Yeah, she did. She did.
It did.
It's okay. I can post it. I just was worried if
And
I.
now I can see it. It's not blurry anymore.
You sure?
Now I can see it. It was blurry just then. It was blurry.
Sometimes
Okay.
it means it's buffering.
So to study, guys, no, what is dehydration? What causes it? What are your expected findings? That's how you're gonna study with the study guide. So what is dehydration?
When you lose too much electrolyte, maybe due to diarrhea or not
Okay,
inadequate.
diarrhea, okay, vomiting,
Increase urination.
okay. Anything that make you decrease fluid in your
Yeah,
body,
like-
because remember we
like-
are
Maybe due to condition you are suffering from polyuria.
okay. So what is your expected findings? Let's talk about skin first.
Skin turgor.
Skin to
Okay.
go.
What about skin turgor?
It's when you pinch the skin to kind of create a tent, and depending on how slow the skin returns back to its body, means that they're dehydrated. And usually before it used to be on the back of the hand, but now they do it like where the clavicle is, and that's when they pinch the skin and then release it and see how quick the skin returns back to the body.
So what's that called?
Skin to go.
So what's a negative response? Skin turgor is the one you are checking. So what do you notice in the skin?
It's tenting.
Tenting, no tenting. Tenting when you, okay, no more in the hands anymore, no, back of the hand, because I can tent because I'm old, no? So it's either in the forearm, the sternum part, clavicle part, no? Because you're gonna really see it in an elderly dehydrated. Jennifer, you've been raising your hand. I forgot to call you. What is it?
I don't know if it's my screen, but are you able to remove the black, like the blocks from the screen? I don't know if it's my screen.
No, it's not yours.
Yeah,
It's better now.
That's good?
Okay, James, when you talk, I hear kind of like cutting off. What was the answer again for skin?
They were talking about skin tugger, where you
Skin
pinch the
tugger?
skin. Yeah, skin tugger. It's where you pinch the skin either where the clavicle is, this like on the forearm, like what Miss Joyce was pointing about. And then basically if the skin is still creating like a tent, means that, and it's slow to return back to the body. It means that it's the that they're dehydrated.
Yesterday.
Okay, do you mind spelling the
My
second
dog.
word you say? Skin something,
My dog.
tenguero?
Oh
What?
no, Mr. Topper put it in there in the chat.
Sage.
Let me see.
And sage.
Skin.
Really?
Oh, okay, okay.
Also
Gotcha.
dry skin.
Yesterday.
Thank
We're
you.
gonna-
That time I called you. My
Dry skin, mucous membranes. Okay, that's good. That's good information.
Dry skin. Oh, okay, okay. Thank you so much.
Okay, how about urine specific gravity? What is the normal? Are you guys putting it in the chat?
Is
I
it
I think
one-
1.3 to 1.05. I'm not sure.
Okay, get your ATI. Get your ATI, guys. You have to know this to compare. The more concentrated your urine is, meaning you
Less.
are dehydrated, right?
yeah. It's
The
true.
more your urine is saturated. Is it the word saturated or diluted? There you go, diluted. Then you okay, right? You're gonna see in your urine, right? When you go number 1, if your urine is too yellow because you're not hydrated enough, no, doesn't mean you're dehydrated, but right? If you drink lots of water, and when you go number 1, you see your urine is a color straw, no? Right? But then you need to know these normal values to check the ATI, guys. You need to know the normal values to say that, is it concentrated? Is it too diluted? Right? Oh, what page?
It's gonna be in chapter 16.
16?
The ATI book.
ATI, yes.
And this is on the nutrition one, or is this on fundamentals?
Fundamentals, right?
Okay.
So what you have? Oh, see, you didn't research for your answer. You're just waiting for my answer.
It's 1.005 to 1.030. But I'm not sure which one it's the most concentrated. I was about to ask you that.
So when you go down, it is too concentrated. When you go up, urine specific gravity. No?
Miss, it's on page
Yeah, tell your
355,
355. Okay.
fluid imbalance.
I'm sorry. I correct myself. If it's high, you are more on the dehydration part. If it's low, it's diluted. Okay?
When you mean high, you mean more than 1.005?
No. More than 1.030. Correct? So on the lower end is 1.005, right? Lower end. And the higher end is the 1.030. Within the range of 1.005 to 1.30, you're good. But when you go way past 1.030, your urine specific gravity is high and you are more on the dehydrated condition. Does it make sense?
So in a way, think about like the acidity, like how it's backwards. Like the lower the number, the more acidic it is, and then higher the number, the more basic it is. But with this, what they're saying is that the higher the number, the more, in a way, acidic and concentrated the dehydration is. It's
Okay.
like reverse.
So above 1.030, your urine specific gravity is increased, you are dehydrated. Okay? Does that answer your question? Take down notes, guys. So how about the pulse? What else do you expect?
Miss Joyce, did you say 1.030 is hydration, right?
Elevated
Hydration.
pulse.
Elevated is you are dehydrated.
Yeah.
Okay, ready pulse. Okay. Ready, okay. How about the BP?
I think blood pressure is the diastolic will be reducing.
With the blood pressure.
So if you're dehydrated, you have hypovolemia. So would you expect your BP to be high?
Low.
No, low.
Okay. Okay, let's connect those physiological, no? How about your neck veins here? Have you heard of jugular vein distension? When you ask the patient, remember in your assessment in ATI, you let the patient lies, no, not supine, reverse Trendelenburg, right? Then you ask the patient to turn to see the jugular vein here. What do you expect with the jugular vein?
Flat.
Flat. No more volume, no more, no, in your system. I hope you're taking down notes. No? Okay? Okay. Number 2, discuss head trauma and neurologic testing of cranial nerves.
When part of head trauma would be dilated pupils.
Dilated pupils.
Because that could be a sign that there's specific head trauma to the patient.
Okay. What else? You seen it, the doctors, no, when they what you call this, in the ER, they patient in the ER, the doctor will open the eyes and flash a light, right? So that is what? Reactive to light, right? What cranial nerve is that?
Second.
Zygote. Zygote.
1, 2, 3.
It's the
What?
second.
Second is what?
The optic.
Optic nerve, no? Optic nerve. Optic nerve, wait. Visual fields, okay. So you want to review the cranial nerve testing on page 171, the box. Okay, the box. There's a box there. How about if you are performing test for balance? What cranial nerve is that?
That's the auditory.
What number?
That would be number 8.
Number 8. Okay, very good. Number 8, no? Cranial nerve number 8, vestibulo.
Mr. James, page what, please?
171.
Vestibulocochlear nerve. What is that called, guys? What is that test for balance?
Sarcoma.
The auditory canal?
The
Are we
Romberg.
talking about?
Mhm.
Romberg's, no? So if I'm your patient and you want to test me for balance, you are testing for cranial nerve number 8. And that is what you call Romberg's. Is that also the DMV way? Like you have to, who can describe what is a Romberg's? How you test for Romberg's?
The feet is together.
Mm-hmm.
Arm together, stand up with closed eyes. You're gonna put the arms kind of a little bit of distance of the patient and check how much the patient is moving.
Check the patient's how much what?
The movement, if the patient can keep the balance of it's moving or touching your arm or your hand.
Are my eyes closed or open?
No, they're open. And
No, his eyes closed.
Yeah. So
Eyes
you
closed,
do,
yeah.
Your eyes closed.
essentially you do it first with your eyes open to see if the patient can maintain balance.
Uh-huh.
Then the way to recheck is ask the patient to close their eyes and see if they can maintain the balance.
It's called head trauma.
No head trauma, wait. So, correct. At first, you're gonna let my eyes open and then, okay. Then after that, you're gonna ask me to close my eyes, just standing straight, no? According to ATI, a slight swaying is normal. But a patient who has an impaired balance will tend to fall. No, they cannot keep their balance. It's not normal swaying is okay. Just even us, no, we sway a little bit, just a little bit. Okay, so please remember that Romberg test for balance and how you do it.
Miss
Okay,
Joyce,
and those. Mhm.
one question. So number 2 is 2 questions in one, right? It says it's cause head trauma and neurologic testing of cranial nerve, right?
Okay.
Okay, I just want to understand the question though. That's when I get all confused. Okay, thank you.
Okay, okay, that's why you said head trauma. The head trauma is your eyes, usually your eyes, no? Because if I have a head trauma, I might, you remember what we talk about what's it called? Glasgow Coma Score. So you want to review those two, the Glasgow Coma Score. The eye-opening, right? Remember those? Eye-opening, what's the next one? Eye-opening, motor. There's 3, right? With the Glasgow. Verbal response and motor. Very good. Thank you. Right? So you want to review those 2. Okay? All right. How about, they always ask for the eyes. Okay? So how about testing for cranial nerve number 3? How would you test for cranial nerve number 3?
when you have the patient, let's say, follow your fingertip or the tip of a pen, and without them moving their head, have them look up, down, left, right, without them moving their head.
Okay, very good. Cranial nerve number 3 is your 6 cardinal gaze position, no? So I'm just following this pencil with my eyes, okay? Okay. Cranial nerve number 2 is the accommodation and the acuity, your vision. Remember that, guys. Cranial nerve number 2, acuity meaning, do you see blurry? You know the Snellen test, right? That's acuity, your vision. Okay? And the accommodation, because the accommodation, guys, you put your pen farther to the face of the patient, dilates, closer, constrict. It's still pupil, right? Does it make sense? So, accommodation and reaction to light is both cranial nerve number 2. Cranial nerve number 3 is the 6 position gaze. Okay? Remember that, please. Okay. How about if I ask you to frown? What is that cranial nerve that you are testing? What is frowning? Oh, the brows?
The cranial
Number,
two.
number,
Smile and frown.
number 5.
Number 5. Isn't it number 7?
Yeah.
Facial. Facial movements. Smile, frown. Okay. How about if I ask you to shrug your shoulders? Just look at the table.
Number 11.
11. Okay. How about your gag reflex?
Number 12.
10.
Gag reflex.
Number 10.
Number 10. Okay. Practice those, guys, no? Okay. Okay, but they always ask about the eyes. Okay, so that's that for cranial nerves. Enumerate complications of immobility. This one's easy, guys.
Yes.
Sylvia, stay after class. We can help you more, okay, if you're lost.
I'm sorry, I hear them say number 10, number 11. I don't know if that's the number that we on. I'm so sorry.
Okay,
It's in your book.
we have to move on. Some of your classmates have to go to work, so we have to move on. Stay after class.
171.
Stay after class. Okay, so number 3, what are those complications of immobility? There's a lot. I'll give you one. Contractures. What else?
Skin impairment.
Skin impairment. Yeah. What else? Pressure ulcer. Oh, there's a lot, guys.
Weakened muscles.
Weakened muscles. You know, guys, in
It dropped.
a matter of days, you're gonna have a weak muscle without moving. Matter of days, guys. Weakened muscles, contractures. What else? Go to the book. Atrophy. Very good. Your muscles is less mass. Oh, what else? How about in respiratory? What you can develop? You're not moving.
Pneumonia.
Yeah, pneumonia, no? Pneumonia, you're gonna have osteoporosis, no? Decreased calcium, right? Decreased calcium. Okay. Discuss edema and grading of edema. What is your nursing intervention? So what is edema, by the way?
When the pressure on the leg, when there is fluid loaded in the interracial, and you check it, it gives you edema 1, 2, 3, 4. 1, 2, 3, 4 is 2, 4, 6, 8, the measurement. Then it's edema, there is severe one and there is light one. I think the highest one is the number 4. That
Okay.
is
So did you remember how I teach you how to remember? The 1,
Yes.
2, 3, 4. How about the others?
8, 6, 4, 2.
Plus 1.
2.
It all depends on how fast the
Okay.
skin returns back. So if there's still a deep crater, then it would be like an 8.
Okay.
And you're pushing into the fluid of where the edema is.
Okay. So
It's the
edema.
millimeters. It's how deep it goes. So 2 millimeters, 4 millimeters, 6 millimeters, 8 millimeters.
Yeah.
Okay, so what is your nursing intervention? Guys, when you say, when the test is asking you for a nursing intervention, it's mostly what you do, not the medication, no? So what is your nursing intervention for edema?
For
Have the
edema,
patient's
I will-
legs elevated.
Okay. Simple as
Reflex tennis.
okay.
Massaging
So ankle
legs.
pumps, right? Ankle pumps, elevate the feet. Right? Okay. So guys, edema, there's two kinds. Pitting and non-pitting edema. Non-pitting, there's no indentation. Okay? When already there's indentation, that is already what you call pitting edema. Okay. So what is this? What is this, number 5? Xerostomia. What is this xerostomia? Yeah, the non-pitting cannot be graded because there's no pitting. Right, guys? Okay, so you're grading because there's dent. Can I say dent? Dry mouth, okay. Halitosis. What is halitosis? Bad breath, no? And guys, this is not just the common bad breath. It is coming from inside, no? Like in your GI, halitosis. That's why it's a little bit really bad, no? From the GI. Thanks, Jan. Yes. Coming from GI. Bruxism. What is this bruxism? Bruxism. Clenching of teeth or grinding, no? Especially at night, no? That's why I had this before. My dentist gave me it's severe grinding, no? We grind our teeth. Sometimes you feel it, right? Sometimes you know when you're grinding your teeth when you're sleeping. So you go to your dentist to give you a teeth guard. Because when you lose the enamel already, you cannot put back your enamel, no? Teeth grinding or clenching. Okay, grinding, more of a grinding. Sword, swordis or sword? What is this sword? Swordis. What is this? What is that? Guys, it's 11. Can you please log out first? Thank you. So you don't forget.
Miss Joyce,
Yes.
I actually, is it alright if I, log off? I'm sorry, I ended up getting like the hands and feet virus, so I have to go get a shot.
Okay. Take care.
Miss Joyce, am I able to record it now that we're out of class? Or
I don't know if it's okay with your classmates. I'm fine with
okay
it.
with them.
Why don't you just record
Is
my
that- can I turn off my camera, like if I'm recording? Can we do that since class is over or no?
Yeah, you don't have to bring camera. Why don't you just record the voice?
Yeah,
The
I am
voice.
doing that. But sometimes
Okay.
it's better to look.
I don't mind. Some teachers do mind though.
Mhm.
Just to let you know. I don't.
I just need permission, I think.
Yeah. No, I don't. But thank you for your consideration.
Miss Joyce, how long are you gonna be doing the review for? You're gonna be doing it for how long?
When we're done.
Oh, okay.
Yeah.
So like for another like 30 minutes or so?
Probably
Because
you
I'm
have to
leaving.
go.
Yeah, because I have to go. I just wanted to hear what you were saying, but I have to
You
go.
can be on your cell phone. This is out of class. You're on your own time.
Okay, cool. Thank you.
Uh-huh. Okay, number 3. Number 3. Swords. What is sword? Sword is
It's crust that collects on teeth and lips.
Lips, teeth, gums. Okay. Wow. Because guys, we're talking about assessment here. Okay. Discuss what is electronic medical record. What is this? EMR.
Isn't that the medical record of the patient, of their of like treatments and plans that's been going on during their visit?
So what's the main purpose of this? Why do we have this EMR?
It's
Documentation.
Documentation, no? It is a documentation, and a documentation is a form of what? So
Proof of what you did to the patient.
what else? So Luis, if you're the nurse yesterday,
Communicate with the other nurses and doctors.
communication, very good. So I don't have to call, Luis, what happened? What did we do yesterday? I have to just check the chart. What did transpire today? What this patient had? Well, what's going on? Remember, guys, always documentation is always a form of number one, communication. And then there's other four: record of legal health, right? For legalities, no? Okay. So assess for how do you assess readiness in ambulation? It's not recorded, it never happened. Thank you, Jackie. Very good. Speaking like a true nurse already. So how do you assess for, give me ways for you to assess if I'm ready for ambulation. Check strength. Okay, remember, you're not gonna ask, right? You're not gonna ask, Mrs. Ellis, are you ready to walk? Are you strong enough? Right? You have to be objective, no? Really measure it, right? Remember this pedal push, plantar push, or dorsiflex, right? Ask, not ask, check patient if she can bear weight, right? Check vitals, all of those, no? Okay. Check if I have balance, check if I have strength in my lower extremities. Okay. Good. Ask and not ask. Check if I can bear weight. Okay. Apical pulse. What can you say about apical pulse? Left mid-clavicular, fifth intercostal space. It is the true beating of the heart. Okay. Apex, sound of the heart, apical apex, no? You already know when do you count for a whole minute, right? You already know when. If I have irregular heartbeat, or if I'm taking medication for my heart, or cardiovascular, no? Hypertensive medications, especially the Olol, guys, no? The Olols, the beta blockers, because it is the Olols, guys, it makes your heart pump slower but more efficient. Okay, so yeah, it is for hypertensive, but it also have an effect in the pulse. Okay, so you're gonna see in the order, hold if pulse is below 60. Because if the effect is to slow the heart, slowing the heart to have an efficient pump, 58, and you still gave that medication, so you are adding to the bradycardia. Okay. Abdominal assessment, huh?
I have a question.
Mhm.
Is does it have to say pulse obtained from the fifth intercostal?
Everything about apical pulse you have to know.
No, but does it have to say that it's from the fifth or just is from the left side?
It has to be because, hold on. It has to be
That's fine. I just wanted to know.
No, because you have to locate. How can you hear the apical pulse if you don't know how to locate?
Okay.
See, I have a heart here. Oh, but yeah. So here, actually, layman's term, it's below the nipple, but we don't say the below the nipple. It's fifth intercostal space. I think it's better with the fifth.
Okay, thanks. Thank you, ma'am.
Uh-huh. Looking for a rib cage. See, Sylvia, here, look.
Yes, ma'am.
This is your clavicle.
Okay.
1, 2, 3, 4, 5.
Okay.
So I just went here but it's usually it's supposed to be here, no?
Mm-hmm.
This is your clavicle here. 1, 2, 3, 4, 5.
Okay. Just making sure, Miss Joyce. Thank you so much.
Okay, practice the habit of looking at the pictures too, so you can connect. Okay, so abdominal assessment, checking for bowel sounds, normal range. So you have to know all this. So what is the sequence of checking your abdominal? Remember, there's 4 kinds that you can assess. Not the quadrants, my dear. Do you palpate first? Do you... Okay, put the sequence. The 4 sequence. What? Inspect, auscultate, percuss, and palpation. Right? Inspect. You need your eyes, only your eyes. Auscultate, your stethoscope. Percuss. But actually, percussion, guys, is done by the higher education nurse, like a BSN, an RN. But still, we have to know this. Okay? And then you palpate. What's the rationale why palpation is the last one?
So you don't stimulate the gut
Yeah.
sounds.
Very good, no? Very good. You don't stimulate because if you stimulate, you're gonna have false reading. Okay. So how do you check for vowel sounds? That is your quadrant.
You start with the right lower quadrant.
Okay, right lower quadrant, then
You go up.
Up.
Up the right, then you go left upper, then left lower.
Okay. So again, picture, because this is the start of your colon, right? From ileum, remember? Then ascending cecum, then ascending. That's why you have to start on the right lower, right upper, left upper, left lower. Even though, guys, if you have flatus or you have gas, you want to massage from here to here to here, and it will help you with your even poop. you know, if you're constipated. No, really, right? Yeah, it can help you too. Okay. What is your normal range for your vowel sounds?
5 to 30 times per minute.
5 to what?
35 times.
5 to 35, guys, according to ATI, 5 to 35. Okay, 5 to 35. And if you have per quadrant, right? 5 to 35. And if you don't hear, add another minute. For 5 minutes, you're gonna count just to confirm there's absent. Okay, very good. Infection and expected lab works. Wow, in ranges too. So if you have infection, what do you expect? In general, let's not add those parasites, those. In general, what is it?
You have
Not low, not low.
you have fever and you have high double white
Fever,
blood
fever, and you have a high white blood cell count. The reason why it's high is why?
because the white blood is fighting the infection in the body.
Yeah, that's why they
So
have to
it's
multiply.
multiplying. Yeah.
Yes, that's why it's high. It's gonna be high. You know you have infection when you have, which is okay, right? It's good that you have a high WBC because it's fighting for you. Okay, very good. And fever is an indication when your infection is getting systemic. Not all infection have fever, right? Okay. When it spreads to you, it's starting to spread in your body, then you will have fever. Okay. Manifestations of hypovolemia. Hypo volume. So you're going into hypovolemic shock maybe. What did we learn about?
Weakness.
The result in urinary retention.
Urinary retention because there's no pressure in your kidneys. Very good. Not enough pressure to filter your waste. But let's talk about temperature, pulse, respiration.
A perspiration gets high, temperature. Your perspiration, your breath, you have tachycardia.
It's gonna be low, hypotension.
Okay, everything. Not everything. So guys, if a person is going to hypovolemic shock, just remember it won't go high. Initially, my blood pressure will be normal, but it will never go high. Okay. My blood pressure, I'm talking about blood pressure. Okay, normal. Then when I start to go down, my BP will go down too with it. Because there's no volume to pump. Now your pulse will be what?
Faint.
Increase, no? Because your body will try to compensate on your hypovolemia. Your heart will think that, hey, let's pump blood. There's no more blood. Actually, yeah. There's no blood. You need to pump more. Okay? That's why it's tachy. You're gonna have tachy and your respiration is increased too. Okay? But your blood pressure will be normal at first and then go down as you progress to your hypovolemia. Okay?
Can you repeat the respiratory? It'll go fast?
Yes. It will go fast.
The temperature.
Takip niya. Temperature, it's not really affected, but as you go, because what does your, how do you maintain your temperature? Through our, blood circulation. You can go low. Okay? So tachy and not tachy, not Brady. Tachypnea and tachycardia is what you expect. No? Okay? So steady pulse, very good. You're gonna have a steady pulse. You're gonna have increased heart rate. You're gonna have increased or tachypnea. Okay, and you're gonna have decreased blood pressure. Okay, and steady pulse. Steady pulse. As your volume goes down. Okay, you're not gonna expect a bounding pulse, right? Discuss urinary tract infection and expected findings. UTI. It is a steady pulse, guys. It is correct. Steady pulse. You're not gonna expect a bounding pulse. You're not gonna expect a normal pulse. Steady pulse. No? Foul smell. How is your urine looking like?
It's cloudy.
Brown.
Cloudy. Brown is already very severe, no? Urine can be cloudy, foul smell. Okay. Okay. Will you have incontinence?
Yes.
And when you have UTI?
Yes. Incontinent, but when you go, no much pee sometimes is coming out. But you feel like going, but it will not come out.
Oh, that's not urinary. Urinary incontinence is you cannot control your urine output.
Oh.
Okay. What else?
Can UTI cause the urinary incontinence?
Maybe in the elderly, but not
Maybe.
for us.
Yeah.
Discuss Erickson's stages of psychosocial development. This one are the generativity versus stagnation, identity versus role diffusion. Did you read about this?
Yes.
Intimacy, only Carla, intimacy versus isolation.
Yes.
Okay. Trust versus mistrust, right?
Trust,
Okay.
yeah.
So read about this, no? So what does it mean?
That's on page, chapter 19, right?
19? Let me see. Chapter 19. It's those stages that it depends on the ages. Okay, depends on the age. Okay.
Trust versus mistrust is in toddler.
Mm-hmm. And then preschoolers have their own. Okay. Bronchi, crackles, wheezing. Let's talk about this. Bronchi, crackles, wheezing, and friction gum. Bronchi, what is bronchi? Bronchi.
It's like at the end of the lower part of the lungs, as if there is water inside.
It's mucus.
Mucus where?
Mucus in the trachea.
Okay, you will hear a low pitched, very good guys. You will hear a low pitched sound over the trachea and the bronchi. So you're gonna put your stethoscope in front, no? Trachea and bronchi. Okay, it's a low pitch, continuous gargling. So it sounds like a mucus, no? Okay. That is bronchi. How about crackles?
Rubbing each other.
Crackles is, okay, wet and popping sounds signifies at the base of the lung, right? It's like your hair, you rub your hair against your index and thumb finger and put it close to your, the book says that, right? To your ear, that is crackles. You can hear it at the end of inspiration. So when you inhale, there's popping sounds. You can
Miss,
indicate.
is that like when kids have mucus on the chest and they breathe and they go crack, 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 like you can hear it cracking? Is that what it is?
No.
Yes. At the end of inspiration, right? It says. So maybe it's pneumonia, no? Within the lungs, no? Base of the lungs. Okay. So I think the word there is the popping sound. And then wheezing. Wheezing is the
movement of air.
high pitch, very good. High pitch, musical squeaking sound. Sometimes you don't need the stethoscope to hear because of the constricted airways, right? With the asthma, right? When a person have asthma because of the airway is constricted, no? Okay, high pitch squeaking sounds. Very good. How about friction rub? Yes, asthma can be wheezing, yes. Scratching, yeah. We heard it. We heard the thing, right? In the friction rub. We heard it in the thing, the video, correct?
Yeah.
Okay.
It's rubbing each other.
Yeah. Friction rub. How to determine transfer from bed to wheelchair? Before you transfer a patient from bed to wheelchair, how would you check?
You first check how you can assist, how independable he is, and you check his resistant on the feet if he's able to even stand up.
Wheels lack is not the answer. Look at the question. How to determine transfer from bed to wheelchair? So meaning, how would you assess your patient if you're gonna transfer the patient from bed to wheelchair? Not wheels lack. I'm not saying it's wrong. Yes, you have to make sure the wheels are locked. Patient assistance and strength, yes.
Yes.
Correct?
Yes.
Balance, just like we talked about earlier. Assessment for readiness in ambulation. Okay? Right? Sometimes questions are repeating, just it's another wording or another sentence. You see how important you know the basic concept. So however the question is constructed, you know your basic concept, you can apply yourself. So ask the patient or check the weight-bearing status. Okay, because we are talking about transferring here. And you wanna assist me. You can assist me all you want, but can I bear weight on my lower extremity? Okay. Discuss and give examples of subjective and objective data. So this one, you already know, right? Subjective
Yes,
coming
yes.
from
Patient.
the person, family, okay. Objective is anything you can measure,
Feel.
see, hear, feel, taste. Labs are objective, right? Labs, laboratory, correct?
Yeah, labs.
Okay.
Sorry, not objective?
Yeah,
Yes.
right? Subjective. Anything you can see, measure, feel, hear, taste is subjective. Correct? Okay. Laboratory. When they take your blood, that's measuring, isn't it? Okay. Discuss laceration, contusion, abrasion, and puncture. So you have to differentiate this, guys.
Yes, lacration is the jagged cut.
Jagged. Okay. Laceration is
Lacration is not cut straight. It can be from accident of a glass cutting someone, jagged, not equal.
okay.
Torn wound.
So like if you the torn tissue. Yeah, torn and profuse bleeding. Okay. Irregular edges. Okay. Torn skin underneath, no? Like when you have when can you have those? An explosion. No?
Okay.
How about contusion? Contusion is like when you bump your head, no, is a contusion, correct? That injuries that don't break skin. Okay, yeah, you're bleeding inside is a contusion. You bump your head. Abrasion.
Like a bruise?
Abrasion, no. Abrasion is more like, I don't know, yeah, scraping of the, like, you rubbed you fell and rubbed your knee in the scrape knee. Thank you, Jessica. Top layer of the skin scrape, abrasion. You know why you need to know all these terminologies? Because when you chart, guys, you have to use these words. No? Puncture is what?
When something stabbed, like a stabbed? of a knife?
Piercing wound, or like somebody stab you is a puncture. Stabbing, no? Piercing wound, okay. Discuss choking and intervention. What is the universal sign for choking?
2 hands on the throat.
Okay, like this, no? Like your left hand is on the throat and you're holding your left hand by the wrist, no? And what is your nursing intervention?
Heimlich maneuver.
Heimlich maneuver. How do you know if a person is choking? How would you confirm?
He can't talk?
He cannot talk. Yes, the patient cannot talk. No, nothing, because the airway is, hold on guys, I just need to block. Yes.
What was the name that you say for the maneuver?
Heimlich maneuver.
Heimlich maneuver. Heimlich. Okay, Heimlich. There you go. Thank you, guys. Okay. And then remember, you have to ask.
Heimlich is that they're choking, right?
Yes. Actually, they don't, according to the book, they don't use the word Heimlich anymore. It's the abdominal thrust, right? Abdominal. Yes. Correct?
Yes.
So when you see abdominal thrust, when you see Heimlich maneuver, it's the same. Okay? All right. So don't do like, oh, I heard Heimlich. Now it's abdominal thrust. It's the same. Okay? So to confirm, I cannot speak. Okay. Discuss ingested poisoning and intervention. So ingested, I put something in the mouth. I got poisoning. What is your priority? ABC?
No.
ABC?
Air.
What air?
To know the type of
Airways.
airways.
Okay, you want to make sure you maintain a client's airway. Okay. Do you induce vomiting?
No,
Why not?
it has been stopped.
Because it might cause, it depends on what the ingested, no? Call poison control. Okay. Do not leave the patient. Always, guys, you never leave a patient. You stay with the patient. That's it. No? You want to identify the poison, or before you do that, you turn the patient on the side, you maintain an airway, right? Maintain a patient's airway. Monitor what is not monitor, know what is ingested and call the poison control center. Do not leave the patient alone. Aquathermia pads, effects of heat and what to monitor during application.
Chill for the cold, for the aquathermia. If the
Okay.
patient is feeling chilled, then you stop. For the heat pad, you check for redness.
Okay, you always assess for redness. If you're applying it, aquathermia, guys, is both cold and heat. But we are more concerned of heat because heat can cause you burns. Okay, the cold, it can cause you, if it's systemic, it's shivering. But we are more concerned of the heat. If you're applying heat, you want to, very good, Mario. Always put towel in between. Very good. Wow, I'm impressed, guys. No, you're studying, and we are only 40 here. That's the number of the class who will pass. 40. I'm just kidding, guys. I'm just kidding. They will pass too. Okay. So monitor for redness because it might cause the patient burn. Okay. How about DNR? Do not resuscitate. Because we're talking about emergency here in this chapter. So you have to know the DNR. Again.
Make sure it's signed by a doctor and someone else.
Okay, very
So
good.
it's a valid paper. If it's not signed by a doctor, it's not valid.
Yes. So if our patient is coding, somebody is with the patient, somebody is going to the chart, somebody is trying to call the doctor, somebody is trying to call 911. If you're the nurse who see that there's a DNR in the chart, but it's not signed by the doctor, you have to call the team, no? To do the resuscitate. I'm sorry. If you don't see a signature, doctor signature, it's not valid, correct? So if there's a signature, call the emergency response team. Or do I get it opposite? I'm sorry, guys. If there's no signature of the DNR, meaning it's not valid, you go ahead with your CPR. I'm sorry, I got it opposite. If the DNR, because the DNR means do not resuscitate, no? So if it's signed, no. But you still have to call 911 or what? You're just gonna let the patient die? Depends on your facility policy. Okay? For my facility where I work at, we still have to call 911, even it's a DNR. You cannot just let the patient dying there. DNR is a prescription. Okay. Sprain and strain. Huh? Sprain and strain. What's the difference?
Strains are injuries to the muscle and sprains are to the joints.
Okay, you strain your muscle, overuse, overstretch, right? And sprain is for the joint. Okay, very good. So what is the nursing intervention for this too?
Rice.
Okay, very good. It's the same. Sprain and strain is the same. It's both rice. You already know what rice is, right? Who doesn't know what rice is?
Me. I don't know.
There, Jan put it in the chat. What is the mnemonic rice?
Rice.
Oh, I didn't know the police. What is police?
Police is protection. OL would be optimal loading, and then it follows with ice, so ice, compress, and elevate.
Oh, wow. That's a new one. I really didn't know that. Thank you.
Sprain and sprain.
But rice
So
is
what do we do with the sprain and sprain?
The same, rice. You rest, immersion, immersion, no, ice. I'm sorry, ice. Compression, bandages, and elevation. Okay. Where did you get that, police?
That was off of Cooper book in chapter 13, I believe.
Thank you. Protection, okay, protection. It's the same. Rest. Protection, you don't want to move that part, okay? You want to rest the part. It's the same, no?
So you mentioned a sprain is for joint and a strain is for what?
Muscle. Muscle. So if I have a sprain, do I exercise my foot?
No.
No, it says rest, right? Okay. So just remember the rice. It's the same as police. The same, it's different. But rice is simpler. Anaphylaxis and expected findings.
I've swollen. The face and the neck is swollen. And lack of breath, you can't breathe. There's pain. You don't have enough oxygen, something like that.
What is anaphylaxis, first of all? Let's
it's a severe reaction to medication or to something that, to medication most especially.
So what happened? Severe allergic reaction. So physiologically, what's happening to you? Are you, how's your blood pressure?
We were discussing number 23.
Oh, hypoxia first? Oh my gosh.
Yeah, we were discussing 23. Yeah.
23, I'm sorry. What is hypoxia, and discuss early and late signs of hypoxia? Okay, hypoxia is what?
The absence of oxygen.
Okay, so absence of oxygen. No, remember we talked about there's a early and late. So remember, our cells constantly need oxygen, correct? Okay, so does it die first? Does it die right away? What happens to the cells when there's hypoxia? First sign.
It look collapse. It's not bounces.
It will starve first, right? That's why, guys, bluish, no, not cyanosis, Sally. Cyanosis is a late sign. That's why I'm trying to explain to you guys. Our cells do not die immediately. It will starve first. Does it make sense? That's why cyanosis is a late sign. Okay? So what is your physical manifestation when you're hypoxia? Somebody put it in the chat. Thank you. Okay, takip niya. tachycardia, elevated blood pressure, restlessness. When you first getting a hypoxic episode, this is how you will be. You're restless, you're confused, you're anxious, right? You don't have oxygen. So how would you imagine yourself deprived of oxygen? Right? Those are early signs. The late signs, Lillian put it in the chat. Thank you, Lillian. Late signs is cyanosis. Now you're going down. When the early signs, tachypnea, tachycardia, right? Now you're going down. Hypotension, okay? Right? Okay. Number 24, CPR and procedure. What is that CPR? Cardiopulmonary resuscitation, and what's the procedure? How many compressions per minute? Do you remember? No, 30.
90.
100. 100 to 120. And then, not 30 guys, 100 to 120. And then, how many breaths? Rescue breaths. Okay.
breaths.
All right. Remember those, huh? Okay, good. Good job. Good job.
So it's not 30, it's 100 and 120.
100 to 120. Right? And with
Wait, I thought it was 30 compressions, 2 breaths to maintain
Yes,
100
yes.
to 120.
Yeah, 30 compression, you do it, and then you stop and give 2 breaths, then you do another 30, 4 times.
Yeah,
That's
and the
one
whole cycle is supposed to be like the maintaining of 100 and 120 beats per
Yeah.
minute,
Minute.
potentially. But the compressions itself, I thought were 30 to 2.
I have 100 per minute.
It's 30
Well, it
to
should be 100 beats per minute, but the compressions themselves, when you're doing CPR, it's 30 to 2,
30
unless you're doing a
compressions.
double rescuer and it's 15 to 2.
Yeah,
Okay, let's see. Let's see.
very sure.
What I have here.
But yeah, if we're talking compressions itself, I'm under the impression that's what they taught us in the CPR class.
Yes.
30 compressions, 2 breaths, unless you're doing 2 rescuers, and then it's 15 and 2.
So it might depend on the question.
Yes.
But no, this is a general question. It says compression 100 per minute. Hmm.
Just Jam put it in the chat. It's 100 to 120 beats per minute, but 30 compressions into respirations per cycle.
Trying to find that.
Yeah, so I think like the complete minute cycle is supposed to be 100 to 120 beats per minute, but the compressions themselves are 30 to 2.
According to my notes, is provide 100 per minute. Let's move on and let's see that later. What is anaphylaxis and expected findings? Let me check my API. Severe allergic reaction, okay, food drug, okay. Spasm and edema, okay, that's why you cannot breathe, right? Cardiovascular collapse. Okay, very good, guys. So, guys, you know when you have anaphylaxis, you have a vasodilation. So when you have a vasodilation, swelling of the airways, yes. That's why they cannot breathe, right? I'm just gonna drop dead. When you have a vasodilation, you're gonna have hypo or hypertension. Hypo or hyper?
Hyper.
Oh. Vasodilation.
Oh, sorry. Hypertension.
Hypo. Yeah. Okay. Hypotension. Okay. Thank you, Sylvia. Sylvia said 400, page 400, 100 per minute. So, okay. So, muscle spasm in the throat area. That's why they cannot breathe. Swelling, okay. And vasodilation, which you can have hypotension. How about injected poisons and interventions? What are these
Wait, one
injected?
second. Just going back real quick to clarify. So if the question is per minute, we say 100 compressions. But if the question is per cycle, it's 30.
I know it's per minute. The cycle is, I'm just following them, 400 per minute, 100 to 120. Where is that? Sequence is 30. Oh, okay, that's why. I see the 30. It says here 100 times per minute. Yeah, there's a difference. 30 compressions. Yeah. I can say that too. 100 per minute. It's 100 per minute. I'm looking at the ATI too. But it's 100 per minute. Anything you want to
Yeah,
clear?
no, seriously, I'm confused. Because is it going to be per minute or is it going to be per cycle? Because they're two different things in my head.
It's per minute. Per minute.
Most time it comes per minute, not per cycle.
I
Most
see
time
what you're saying, the
comes
cycle.
per
I see the cycle too. 30 cycle, 30 compression per cycle to rescue breath. It is in page, it's per minute. It's in page 400 also. The sequence is 30 compression to 2 breaths. You see that into 400? But I know it's 100 compression per minute. Wow, okay. So let's follow the 100 compression per minute. Carla, where did you learn that? In CPR? CPR?
Yeah, in the CPR class.
Yeah, so we have to follow the book. I know I attended that CPR class too, and they said, oh, in the fire training, they said it's not always race, right? Did you hear that from them? But ATI says it's race. So I would follow race. You know? Okay. Okay. Let's follow the book. It's the book will ask you, not the CPR people. They test you for the CPR, then you follow them. Okay. Injected poison. But you can question ATI. It's okay. You can send a letter and they would correct it if it's really wrong. They will consider. Yeah. Okay. They will really consider your question. Okay. What is injected poison? How would you say what is this injected poison? Animal bites, yes. Snake bites. Okay. So what is your nursing intervention? Did you remember? Venom, okay. Insects, bees are injected poisons. Do you remember? What do you do?
You use a scraper, edge of a scraper to scrape the shaft.
Okay, you don't use tweezers. Okay, very good. That's one. What else? Restrict movement because you don't want the venom to spread. You don't put it above the heart, remember? Because you don't want to encourage blood flow. Do not attempt to remove stinger with the tweezer, no? You just scrape it. Wash with soap. Wash the irritant, no? Okay. What else? Do I need a tetanus shot? Why? Why?
If it's a snake, you need antivenom.
Okay. And then you also have to bring that snake with you in the hospital to study. But yes, you need a tetanus shot with your injected poisons, no? Okay. What are the 3 nursing intervention for bleeding? Pressure? What pressure? What kind of pressure?
Direct
Okay. Oh, you're breaking up.
intermittent pressure.
Carla, you sound like a robot.
And
Okay.
Okay.
Supposed to use if the other two fail.
Okay.
Why is that? Sounds like a robot.
That's a Wi-Fi issue. I'm just kidding. Okay.
Yeah.
Okay. So the first is direct pressure, no? Right. Direct pressure. Direct pressure. If you're bleeding here, you just put direct pressure. Indirect pressure, what is indirect pressure?
Above the bleeding.
You occlude the artery above the bleeding, no? You occlude the artery above the bleeding site. And then, yes, indirect by compressing the artery above the bleeding site. Then the last, and if you don't have any more choice, and do the tourniquet, no? Do the tourniquet. Don't care about the tissue damage. Well, you need to stop that bleeding, right? You don't have a choice. Then It doesn't say in the book that do not do it, but it just say that is the last resort because it damages the tissues, no? Especially if you're not trained to do those. Okay. Review your ABCs because your prioritization, guys, no? So you have a guide, ABC, no? Know what is a Glasgow coma scale. How are you grading for the Glasgow coma scale, right? Okay, review those. Eye-opening, verbal, and motor. Can you please review? It's in my slide, no? So you're gonna score, right? You're gonna give the patient a score depending on what is the response, right? Okay, yeah, you were a robot earlier. Like review location of pulses, okay? From head to toe.
It's just, can I read it out for them? For us?
You what? Can you what?
Can I just read it out for us?
Of course.
Temporal pulse, carotid pulse, apical pulse, brachial pulse, radial pulse, femoral pulse, popliteal pulse, and pedal pulse.
Is that the answer for 28?
Here.
ABC?
Sylvia, stay behind. Here, look at this.
Yeah, I'm here.
Okay. Temporal. Very good. Thank you, Linda. Temporal, facial, carotid, right? Brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. So review. Please review this. If we were in school, this is my extra points for you. But we're not. Next time, when we're in school, I'm gonna have more. Oh, we're almost done anyway. Maybe Miss Arian will give you. No different kinds of pulses. Different kinds. Oh, okay. This is what? Bounding, ready, regular. Okay. Normal, regular. Okay. Urticaria. What is urticaria? What's a lay term for urticaria? Hives. Okay. Hives. Urticaria. Hives, no hives. Kyphosis. Where is kyphosis happening in the spine?
In the lumbar?
Kyphosis.
The thoracic.
Thoracic spine, no? Thoracic. Lordosis.
Lumbar?
Lumbar, yes. L and L, lumbar. Lordosis, lumbar. What is ankylosis? Stiffening and fusion of the joint. Scoliosis.
The S shape.
S shape of the spine. Okay. Lateral curvature of the spine. Is this the same? No?
It's just, what is the first one? The ankylosis?
Ankylosis, when you have a joint stiffness and then it will fuse together. Ankylosis. Look, this one.
Oh.
It's fusing together.
Oh.
We're gonna talk more about this in term 2, musculoskeletal. What is skin turgor? How do you resiliency of the skin? Okay, very good. That's a good word, resiliency of the skin. How do you perform it again?
From the clavicle area, a pinch on the clavicle or on the back of the hand.
Okay, forearm, sternum, clavicle. Okay, you pinch a skin area of the skin, no? So the negative sign is tenting. You're gonna have a skin tenting, and it signifies dehydration, no? Erythema.
Redness of the skin.
Okay, erythema or redness. So in your heat packs, which you always want to apply a towel be in between. So if you notice erythema in the skin, what are you gonna do?
You stop.
Stop it right away, stop. How about blister? What is blister?
When the skin is swollen with some liquid in it, some fluid in it.
Okay, so first, second, third degree burn.
First.
Second, no?
Okay.
Actually, guys, when you talk about burns, the only time you're gonna see blister is in the second degree. First degree is skin intact with redness, your sunburn. Okay? Only time you're gonna see blister is on the second degree. Because in the third degree, it's already open. Well, there's some burns that second degree is also open, but what makes second degree burn different is you see blisters. When it's open and you don't see blister, that's third degree. Heimlich maneuver, you already know, right? Abdominal thrust to help the patient, to help the victim expel what is blocking the airway, right? There's a pressure, right? Tetanus immunization. What?
What do we need it for?
10 years, very good. It lasts for 10 years. You'll get this when you have injected poisoning, no? Especially snakes, because snakes, you don't know where the dirt, they're in the dirt. So the book says you need a tetanus when you have a snake bite. Okay. Tachy is meaning always
fast.
Fast. Okay. So how would you differentiate tachy and bradycardia when you don't know what is your normal range for your heart rate? So please know what is the normal range for heart rate. Right? You know what tachycardia means, but how do you apply it? Huh? Guys, no? So when you see something like this, tachycardia, bradycardia, it's not only the word that you want to know. When is it tachycardia? When is it bradycardia? Correct? So know your normal ranges. And last is Romberg's. We talked about this.
The what?
The Romberg. Romberg's test.
Okay, the balance.
Check for the balance. Okay. How long will you apply check for balance? Okay. Like Luis said, at first the patient will be open eyes. And then later on, you ask them to close their eyes. Little bit swaying is normal. But the patient who cannot hold their balance is positive for Romberg's test. Okay. How long will you apply your ice in your sprained ankle? 1 hour, 2 hours?
20 minutes off, 20 minutes on.
Oh, it's like wax off, wax on, huh? No, okay. 20 minutes. 20 minutes max. Then you just can repeat it every hour. But you don't put the ice for the whole 1 hour. Right? This is in the book, right? What else?
So we're gonna be testing for Romber's test for 20 minutes.
No, ice, the application of ice. I was asking about application of ice, how long? How long are you gonna apply?
It's supposed to be 20 minutes, but if the patient is shivering, even if it's not up to 20 minutes, I think we can remove it. But the book said 20 minutes.
20 minutes, yes. Okay. What else? That's it. I think that's it, no? That's the
Miss,
whole exam, yes.
So the patient stands with feet together, arms on the side, with eyes closed or open.
At first, you want her to have her eyes open.
Okay.
Because, yeah, then close. After that, you ask them to close the eyes. Because, you know, Sylvia, I can keep my balance if I see my environment.
Yes.
Yeah.
Yeah. So if it's closed eyes. Thank you guys for your time. Thank you.
I see what you're saying. Yeah. You'll balance yourself if your eyes are closed.
Normal is a little bit of swaying. It's okay. But if I cannot keep my balance, you're welcome. You're welcome, guys. Thank you. Thank you for your time. Put your name in the chat so I can check the attendance.
I have a question.
Yes, please.
I have a question about the second one is a head trauma and neurologic testing cranial nerves. Can you just please explain more? I had a hard time for this question.
Okay, so you know, neurologic is neuro in the brain. You know, if you have a neurologic impairment, some of your normal reflexes, sensory and motor response will be impaired too. Because the brain controls everything, right? So if you're you've seen it in ATI, right? The assessment. So how do you test for my smell?
For your smell?
Yes. Did you watch that in ATI?
Yes, and honestly, I just studied the ATI rules because of everything on it.
So those are neurologic testing. So if you're testing for my sense of smell, what cranial nerve are you testing?
Sensory is optic.
Sensory.
Olfactory.
Olfactory, cranial nerve number 1, right? It says in your ATI, you want to use mint.
Oh my God, I just got my answer. That's fine. I just understand what's going on. Okay, sorry. I had a hard time honestly in the numbers, but I just look at the box, so I figured out. That's fine.
So not only the numbers you want to memorize, because they might not give you the number. They might give you the name.
Yeah.
Right?
Yes, I've got this.
So cranial nerve number 1, olfactory. Cranial nerve number 2, optic. So memorize both. Because I don't know what they're gonna give you in the test.
Okay, and one more thing, I have another question. So the number 4 for the edema and grading of the edema. Grading of the edema, for example, is if you want to see how deep is the edema, you're gonna go 2, 4, 6, 8, right?
+1 or 1 plus is 2 millimeters.
Oh.
plus 2 is 4 millimeters.
6 millimeters and then 8 millimeters. Okay, I just remember.
Yes.
Sorry.
You have my slides, right?
Yeah, I have it. I just remember. Sorry, I couldn't remember during the review, so I thought this.
Miss Joyce, please, where can I get your slide? Your slide?
I will email it to you.
Thank you. Thank you. Should I remind you?
Linda, anything you need, you just tell me and I will know.
It's the slide to my email, ma. Thank you.